I'm so happy to share the fulfilling and richly satisfying life journey today with you all. I would like to dedicate this honor to the memory of my parents, Srimati Uma Devi and Dr. K. N. K. Gowda. I'm very thankful to you all for this honor bestowed upon me. I have so much to share, so much of experience that I've had in my life to share. But I thought, let me tell you about why I became a diabetologist for this day. It all started with my mother. When she was 33 years old, she had to undergo a surgery, and at that time, she was diagnosed to be a diabetic. And I have seen for the next 38 years her journey, good, bad, ups and downs, and all the travails of diabetes, living with diabetes. And the maternal side, the first degree relatives and all those people, uncles, aunts, they were all diabetics by the time they were 40, 45. And I've seen the troubles they have taken. So that made me resolve that during my PUC days, I should become a biochemist, do my PhD, and do a lot of research in the field of diabetes. But fate had a different road for me to take. My father said, "You have no other choice but to become a doctor, join MBBS." I became a MBBS student. And during my MBBS student days, I was exposed to the reality, the stark reality of diabetes. And when I did my MD general medicine, I really started the theoretical and practical components of what is diabetes, how to manage, and etc. like that. And post masters for the last 35 years, I have done diabetes as one of my passion in life, and I hope I have done good things. Having said that, when we are in clinical practice, today especially so, everybody talks about evidence. Without evidence, where is your clinical practice? Where is it going? And basics of clinical practice can be eminence, evidence, eloquence, vehemence, nervousness, confidence, all of them based medicine. You remember? Eminence based medicine, evidence based medicine. And these three so called eminence, evidence, and eloquence based medicine caught my imagination and made me start thinking in these lines. And eminence based medicine, as definition goes, experience is worth any amount of evidence. I fully agree. And jocularly, the halo effect, they say, the eminent physician's white hair, balding pate, and probably jetting out tummy makes the seniority component bring a touching faith in clinical acumen. And eloquence based medicine. So many times we have seen sartorial elegance and verbal eloquence, especially in the so called debates of CMEs, are powerful substitutes for evidence. There are hardly any evidence, but the way the powerful eloquence of the speaker makes it worthwhile. And talking about evidence based medicine, which are the building blocks of clinical guidelines that we follow, very clear definition is there, but the mission of evidence-based medicine is surprisingly recent. It's just about 20, 30 years old, not like hundreds of years of clinical medicine. And when it is not properly applied, it not only undermines the reason for its existence, it also can harm. Don't you agree? The guidelines that are born out of evidence-based medicine that we are talking about, if it's not properly promoted, it can be unsuited for its application. Sometimes these guidelines are used by vested interests to advance an agenda or control providers like you and I. So, individually or personally speaking, this is the rating scale I can share with you about evidence based medicine or whatever based medicine for clinical practice. Class 0 to class 5. Class 0 is things I believe even before evidence based medicine, like my parents taught me, my teachers in medicine taught me, my students, my patients taught me. It goes on. Class 1 RCTs that agree with what I believe. Class 4 RTCs that don't agree with what I believe. But what's important is class 5. What you believe that I don't. This is the biggest concept or the logarithms that we are in, and that is the argument that's going on. What you believe, I don't. What I believe, you don't. So that's how I rate the so-called concepts. And some thoughts to share with you about this. The emphasis of EBM is a shift from trust in experts to trust in numbers. Experts vis-a-vis numbers. But over-reliance of evidence can result in an inappropriate application, and over-reliance on clinical expertise may be outdated and sometimes detrimental to patient care. So over-reliance is the catchword, not good for either one of them. However, both are necessary in a reliable manner. So the best approach would be to put them together. Best available evidence, clinical judgment, and patient values. Shared decision making, everybody talks about patient first. Put all of them together, you have evidence-based medicine, not just best available evidence. So, in true sense, inculcate the art and science of medicine into clinical practice. I'm sure we'll all be winners. What's the right thing to do? The second question. What's the right thing to do? I have done. You all remember the sulfonylurea story. There are so many evidence for and against sulfonylurea's safety and durability. It's going on, but eminence, people we have used it for many number of years. It is still very useful when individualizing treatment regimens according to patient characteristics. So this is the confluence that we are talking about. So what's the right thing to do? Cultivate superb research extraction and replication skills, evidence, research-driven eminence among co-workers and outside peers, eminence, communicate using a well-practiced eloquence that inspires people to listen and pass along your message to your professional community and general public. Eloquence. The intersection of evidence, eminence, eloquence as evidence-based medicine is the right thing to do, my feeling. Finally, the often talked about morals and ethics, I have a simple take on it. Morals are the customs established by group of individuals, whereas ethics defines the character of an individual. An individual versus group of individuals is morals and ethics. In simple words, morals are how we treat people we know. It makes us good parents, good friends, good neighbors, etc. And ethics is how we treat people we don't know, our new patient who comes to us, the attenders, etc. This is how we build a society, and a nation is built through proper ethics and also morals. Finally, let us be humble in accepting what we don't know. The way we treat those known to us and unknown to us defines our personality, attitude, and behavior. Don't accept readily every novel therapeutics that comes a long way just because it's accompanied by earnest testimonial. Lastly, be kind because everyone you meet is fighting a hard battle to survive. Namaste.